Good day, clinical instructor. I am Shane Briones from BSN2A. So for today's video, I'm gonna perform Leopold's maneuver. So the first thing we should need to do, we are gonna wash our hand. Second is, we're gonna provide a client's privacy. Identify the client using the two identifiers, the name and the date of birth. So then, we're gonna explain to the client the procedure. Hello, ma'am. I am Shina Briones, your student nurse. So for today, I'm gonna perform Leopold's maneuver. Is that okay? It won't take long and it will not hurt. Then let's proceed. Instruct woman to empty her bladder first. Place woman in dorsal recumbent position, supine with knees flexed to relax abdominal muscles. Place a small pillow under the head for comfort. Drape properly to maintain privacy. Explain procedure to the patient. Warm hands by rubbing together. Cold hands can stimulate uterine contraction. Use the palm for palpitation, not the finger. So for the first maneuver, fundal grip, it is to identify the head or the bottom of the baby. Using both hands, fed for the fetal part lying in the fundus. So we're gonna detect the top of the fundus. So for the second maneuver, umbilical grip, it is to identify the back and the extremities of the baby. One hand is used to steady to the uterus on one side of the abdomen, while the other hand moves slightly on the singular motion from the top to the lower segment of the uterus to feel the back and small fetal parts. The third maneuver is Pollick's grip. It is to determine if the baby is engaged or not engaged. Using thumb and the finger, grasps the lower portion of the abdomen above symphysis pubis. Press slightly and make gentle movements from side to side. If you can lift the baby's head, it means the baby is not engaged. But if you can't lift the baby's head, it means it is engaged. For the fourth maneuver, pelvic grip, it is to verify the position of the baby. So we're gonna face to the mother's foot of the woman, then palpate the fetal head pressing downward about 2 inches about the inguinal ligament. Then use both hands. Good attitude. If bro correspond to the side, second maneuver that contain the elbows and knees. For attitude, it is if examined figures will meet an obstruction in the same side as fetal back, hyperextended head. Also palpates infants anteroposterior position if brows is very easily palpated. Fetus is at posterior position, occiput painting towards woman's back. That's all. Thank you.